New questions tonight about the origins of the COVID-19 pandemic. The U.S. State Department's former lead investigator believes the virus could have come from research being done on a bioweapon from a lab in Wuhan, China. That investigator, David Asher, joins us now. David, welcome.
Thank you very much. Nice to be with you.
I want to read something from medicalpress.com today. They talk about the huge delay in getting experts into the country to actually look around in China, and also now the delay in the report that's supposed to be coming out. The COVID origins report postponed, likely due next week, according to the WHO. They say in the end, this team of investigators, arrived in Wuhan more than a year after the first cases of SARS-CoV-2. The virus that causes COVID-19 disease were first discovered there in December of 2019. With that lapse in time, David, what can we expect to find out? What may we never find out?
Well, I think one of the first things your listeners need to understand is these people really aren't investigators. They are medical doctors and have different capacities in the medical field, but none of them is a real professional investigator. There are people that are medical sleuths that are out there in the world. We have a community of them within our Center for Disease Control, but you can notice that none of them is actually invited to join this WHO delegation. And the one American guy named Peter Daszak, who's leading the sort of U.S. contingent, I guess we'd say, for the delegation, is a fellow who was employed by the Wuhan Institute of Virology on joint research funded, of all places, by the National Institutes of Health. So the level of complicity and compromise to begin with, the massive time delay, the time that the Chinese have taken to destroy evidence, cover it up, and now handpick the members of our own delegation, including their guy who's worked with them under contract, ironically funded by our own, lead doctor, Dr. Tony Fauci. Is a mystery, but it's all summarized around one phrase, and that's called gain of function. And that may sound really complicated, but it's not. It's the manipulation of genetic material to increase the virulence of diseases. For some reason, the United States medical disease community and with many international partners has decided that we can get ahead of biology using synthetic techniques. And we've been doing it, including in partnership with the Chinese Wuhan Institute, since at least 2007. I would argue that the difference between gain of function in the context of developing a weapon and gain of function in the context of even developing a vaccine to protect against a weapon, there's not much of a difference these days. And so you're not going to really understand the nexus of this program and what it was trying to accomplish unless you understand who was involved, where the money was coming from, and what their motivations were. And what we disclosed on January 15th of the State Department from Secretary Pompeo was this was a military-funded secret program. It was being carried out by People's Liberation Army scientists, not just normal folk. They were directly tied into the biological weapons program of the Chinese government. This wasn't the National Institute of Health, okay? Mm-hmm. This was something, resembling something out of a sensitive U.S. military program. So the whole thing is sort of screwed up from top down. Well, and the fact that the Chinese have covered it up is largely because they want to protect what was a weapons program, in my mind.
Well, they've had a lot of time. We will watch for that WHO report next week, knowing what you have said, taking the qualifiers there. And we'd love to have you come back and talk about it once we have what they put on paper as their cause and get your reaction to that as well. David Asher, thank you for your time.
Okay, thank you very much.